السلام عليكم طلاب صف خامس، إن شاء الله تكونون بخير. Our lecture today is about the lens. وياكم دكتورة هند أحمد. The lens is a transparent biconvex structure. It is situated behind the iris pupil diaphragm. This is the iris pupil diaphragm, and this is the lens. And in front of the vitreous body, هذا الفيتريوس body، هذه اللينس. It is one of the refractive media of the eye. It contributes about 15 diopter of the total refractive power, which is 58 diopter. Lens also play important role in process of accommodation. The lens is made of three parts: an elastic capsule, lens epithelium, which is confined to the anterior surface of the lens, and the lens fiber, which constitute the main mass of the lens. The lens fibers are formed by multiplication and differentiation of lens epithelial cells at equator. The earliest formed fibers are those in the center, forming the lens nucleus. Here supposed to be the lens nucleus, while the later fiber in outer layer forming the lens cortex. This is the lens cortex, the outer part of the bulk of the lens. The lens is held in position by a series of radially arranged fibers, collectively called as suspensory ligament or zonules. Here is the suspensory ligament or the zonules. A cataract is a clouding of the natural intraocular crystalline lens that focuses the light entering to the eye onto the retina. This cloudedness can cause a decrease in vision and may lead to eventual blindness if left untreated. Cataract often develop slowly and painlessly, so vision and lifestyle can be affected without a person realizing it. Cataract can be acquired or congenital. Acquired cataract will be illustrated in this lecture in the following categories: age-related cataract, cataract and systemic disease, secondary cataract, traumatic cataract, drug-induced cataract. Age-related cataract. The pathogenesis is multifactorial and not completely understood. Chemical modification of lens protein can play a role in cataract development. Age-related cataract can be classified according to its anatomical location into the following. Number 1, subcapsular cataract. Anterior subcapsular cataract lies directly under the lens capsule, while posterior subcapsular opacity lies just in front of the posterior capsule, and due to its location at the nodal point of the eye, a posterior subcapsular opacity has a more profound effect on vision than a comparable nuclear or cortical cataract. Near vision is frequently impaired more than distance vision. Patients are particularly troubled under condition of miosis, such as produced by headlight of incoming car and bright sunlights. يعني حتى نوضح هذا البرنسبل اللي يصير ويانا بالبوستيريور سبكابسولار كاتاراكت، انه لما يصير عندي مايوسز بالبيوبل اللي هو ممكن يصير طبعا من شخص يطلع بضوء الشمس، او يكون اكو فد سورس مال illumination عالي، او مثلا الشخص اللي يسوق بالليل ويجي الضوء مال لايتات بوجهه مع السيارات الاخرى، زين عيني، راح يصير هاي الكونديشن بهاي الحالتين حيصير عنده مايوسز. المايوسز راح يخلي اللايت ريز تدخل بالضبط تتركز بالنودال بوينت، حيصير مرورها ما راح تدخل من مساحة أكبر لأنه البيوبل حيكون مايوسد. لذلك بالكونديشن مال مايوسز راح يبين السكاترينج مال لايت أكثر، لأنه راح يمر أغلب البيم مال لايت راح تدخل من النودال بوينت اللي هي already occupied by the posterior subcapsular cataract. كذلك بالريدنج النير فيجن. بالبروسس مال accommodation واحدة من عند الترايد مالتها اللي هي المايوسيس، أيضا حيصير عندي مايوسيس ونفس البروسس راح تنعاد. لذلك اللي عنده posterior subcapsular cataract راح يعاني من مشكلة while reading. Nuclear cataract starts as an exaggeration of normal aging changes involving the lens nucleus. It often associated with myopia due to an increase in refractive index of the nucleus. Nuclear sclerosis is characterized in its early stages by a yellowish hue due to deposition of urochrome pigments. Cortical cataracts. The opacities start as clefts and vacuoles between lens fibers due to hydration of the cortex. Subsequent opacification results in typical cuneiform wedge-shaped opacities. أيضا راح نتطرق لموضوع الكاتاراكت maturity. بداية موضوع الكاتاراكت لازم نخلي ببالنا إنه أكو كاتاراكت maturity whatever the type of cataract. Immature cataract is one in which the lens is partially opaque. يعني أكو جزء من اللينس كاتاراكتس وجزء لا. Number 2, mature cataract is one in which the lens is completely opaque. يعني كل اللينس كاتاراكتس كلها opacity. Number 3, hypermature cataract has a shrunken and wrinkled anterior capsule due to leakage of water of the lens. يعني هاي مرحلة ما بعد الماتشور كاتاراكت يسموها hypermature، لما اللينس يصير بيها leak of water contents. Cataract in systemic diseases can occur in diabetes mellitus. Hyperglycemia is reflected in a high level of glucose in the aqueous humor, which diffuses into lens. Glucose is metabolized by aldose reductase into sorbitol, resulting in secondary osmotic overhydration of the lens substance, with subsequent cataract formation. Myotonic dystrophy, also one of the systemic association of cataracts. About 90% of patients develop visually innocuous fine cortical opacities in the third decade, which evolve into visually disabling posterior subcapsular opacities. Atopic dermatitis, another association. About 10% of patients with severe atopic dermatitis develop cataracts in the second to fourth decade of life. طبعا الصورة اللي بالسلايد عندنا هنا هي shield like opacity in the lens اللي هي عادة characteristic بالpatient with atopic dermatitis. Lastly, neurofibromatosis 2 is associated with cataract in about 60% of the patients. Secondary cataract. A secondary complicated cataract develops as a result of some other primary ocular disease. One of the most common causes, chronic anterior uveitis. We can see in this picture the posterior synecdoche, which is the attachments between the iris tissue and the anterior lens capsule, resulting in this whitish opacity which represent a cataract. And this is the posterior synecdoche, multiple aggressive posterior synecdoche that occur in chronic anterior uveitis. Secondary cataract also occur in acute congestive angle closure glaucoma, high myopia, and hereditary fundus dystrophies. Traumatic cataract. Trauma is the most common cause of unilateral cataract in young individuals and may include the following: penetrating trauma, blunt trauma, electric shock, infrared radiation, ionizing radiation. In our slide we can see the most interesting appearance of the rosette cataract that occur in blunt trauma. It can be noticed after patient affected by blunt trauma. Drug-induced cataract. One of the most common drugs that result in cataract formation, steroids, both systemic and topical, are cataractogenic. Other drugs, busulfan, gold, allopurinol. Treatment of cataract. There is no medical treatment to prevent the development or progression of cataract. Treatment only by surgery. Indication for surgery include number 1, visual improvement, which is by far the most common indication for cataract surgery. Operation is indicated only if and when the opacity develops to a degree sufficient to cause difficulty in performing essential daily activities. يعني احنا نقول patient wish، patient يقول I'm compromised، هذه impairment مال vision دا تعيق daily activities مالتي، هذه اللي يسموها visual improvements. Number 2, the medical indication are those in which a cataract is adversely affecting health of the eye. For example, phacolytic or phacomorphic glaucoma. Cataract surgery to improve the clarity of ocular media may also be required in the context of fundal pathology, for example, diabetic retinopathy, requiring monitoring or treatment. يعني نقصد إنه الفاكوليتيك أو الفاكومورفيك جلوكوما ممكن تأذي الآي نفسها، فلازم إحنا نتخلص من هذه الفاكوليتيك اللي هي راح تبدي adversing effect، يصعد الانترا اوكيولار بريشر حيأذي الآي، أو ممكن عندي كاتاراكت دا يعيقني ما دا يخليني أشوف البوستيرير سيجمنت. فالاسسمنت، المونيتورينج، وايفن التريتمنت مال البيشنت، مثل البيشنت اللي عنده diabetic retinopathy ما راح أقدر أكمل وياه. I should remove the cataract to complete with my management of the posterior segments. فتعتبر medical indication. Anesthesia. The vast majority of cataract surgery is performed under local anesthesia, although general anesthesia is required in some circumstances, such as children and many young adults, very anxious patients, some patients with learning difficulties, epilepsy, dementia, and those with a head tremor. طبعا بالسلايد مالتنا دا نشوف هذه البيكتشر اللي تبين لي واحدة من طرق اللوكال أنستيزيا وكيفية إعطاء اللوكال أنستيزيا بهذا الشكل، وطبعا فد certain anatomical points نتبعها حتى ننطي اللوكال أو الباريبلبر بلوك أو الريتروبلبر injection. surgery. راح نتكلم عن أنواع السيرجري اللي ممكن نستخدمها بالكاتاراكت ريموفال. واحدة من الطرق القديمة اللي هي الانترا CAPSULAR cataract surgery, an old procedure in which the surgeon removed the complete lens within its capsule and left the eye aphakic without a lens. Then patient vision was corrected by extremely thick eyeglasses or by contact lens or by implantation of anterior chamber intraocular lens. هاي الطريقة القديمة اللي هسه نادرا ما نستخدمها، يعني يشيل كل اللينس هي والكبسول مالتها. قبل كلش كانوا ما يزرعون عدسة، ما كان العدسة شلناها، فيضطر يعوض الرفراكتيف باور مال اللينس اللي رفعناها بجلاس أو كونتاكت لينس. بعدين شوية تطورت الأمور، بدأوا يسوون implantation of anterior chamber IOL بعد الانترا كابسولار كاتاراكت extraction. طورت الأمور أكثر، دخلنا بالإكسترا كابسولار كاتاراكت surgery which is a category of eye surgery in which the lens of the eye is removed by manual expression through incision about 10 mm made in the cornea or the sclera of the eye, while the elastic capsule هاي النقطة مهمة وبيها فرق عن الانتراكابسولار. The elastic capsule that covers the lens is left partially intact، يعني نعوف جزء من الكبسول to allow implantation of intraocular lens. هذا الجزء اللي تركناه حنسميه الكابسولار باج، زين، يعني اللي هي عادة البوستيرير كبسول وجزء من الانتيرير كبسول حتى نزرع العدسة الصناعية بدل العدسة اللي احنا شلناها ونعوض الرفراكتيف باور للآي. ندخل بالفاكو emulsification in which the lens is broken into fragments inside the capsule by ultrasound energy and removed by aspiration through corneal incision, which is about 3 mm, followed by implantation of foldable IOL through the small incision. Phacoemulsification has become the preferred method of cataract extraction over the last 15 years. The smaller incision of phacoemulsification is associated with little induced postoperative astigmatism and early stabilization of refraction, usually 3 weeks for a 3 mm incision. Postoperative wound-related problems such as an iris prolapse have been almost eliminated. One disadvantage of phaco that it is require complex machinery to break up the lens nucleus and remove it through a small incision. Considerable training and practice is required to learn the techniques adequately. Congenital cataracts. Etiology. Congenital cataracts occur in about 3 in 10,000 live births. 2/3 of cases are bilateral, and the cause can be identified in about half of these affected cases. There is several association with congenital cataracts, starting with systemic metabolic association like galactosemia, Lewy syndrome, Fabry disease, monocytosis. Also, there is association with intrauterine infection, mostly with congenital rubella, toxoplasmosis, cytomegalovirus infection, and varicella. Also, there is associated chromosomal abnormalities like Down syndrome, Edwards syndrome. Very important vital point is the treatment of congenital cataracts. Usually the surgery involves anterior capsular access, aspiration of lens matter, capsular access of posterior capsule, limited anterior vitrectomy, and IOL implantation if appropriate. It is important to correct associated refractive errors. Timing is crucial, and the main considerations are as follows. Number 1. Bilateral dense cataract require early surgery when the child is 4 to 6 weeks of age. Number 2. Bilateral partial cataract may not require surgery until later. Number 3. Unilateral dense cataract merits urgent surgery, possible within days, followed by aggressive anti-amblyopia therapy. And number 4. Partial unilateral cataract can usually be observed. Dear student, thank you for your listening. I'm ready at any time for any of your questions to discuss, to explain. Thanks again.